Martha and Mary was formed as a children's home in 1891, and it served that function until 1953, when the corporation saw the need for a nursing home. Then as things change in the community, skilled nursing care has come in.
I get a lot of feedback from social workers at Harrison Medical Center, and frequently they talk about Martha and Mary as the prime spot for patients to go. There are of course others that have provided excellent care, and there's some competition involved, but Martha and Mary has been the largest skilled nursing facility in the county for many years and provides a wide spectrum of services.
Well, the care for my wife here at Martha and Mary's is meant everything to me. My wife Karen came in here almost 3 years ago in a terminal condition. I didn't know what to expect, but it was far beyond any expectation that I could ever imagine. It's just good to know that if I take off some time, that she's in good hands and being really cared for as well.
I think our biggest strength is our staff. They're all very caring. They make you feel comfortable right at first when you come in. They kid with you. They make you feel at ease. And I think when you're coming into a new environment, that's really, really important.
I had a stroke December 4th, 2006, at my son's house in Sabledale for Thanksgiving time. And I went to another facility, and afterwards my son had to find a new place. So he looked all over the peninsula for different homes that I could go into, and kept coming back to me and saying Martha and Mary is the best. So on February 6th, 2006, I came to Martha and Mary, and I just feel I feel comfortable with the people that take care of me, which is important to me. Since I take about 30 pills a day, I have to trust them to know what I'm taking. And I think that's important to me, to feel comfortable, to feel at ease.
Rehabilitation is so important in a short-term and long-term care facility. We, I feel, put a lot of interest in the patient regaining function and getting the best for them and what they want for themselves. Whether they're staying here and they're going to be in a room where we want them to be as independent as possible, or where they have to return home by themselves without much help, and rehabilitation really is a catalyst to that.
I think the one thing that stands out for me is looking into the fact that I needed something for the lymphedema, and the doctor didn't order that, so they got in touch with the doctor and are making arrangements for that. So they identify your needs, don't do just what the doctor orders.
What makes Martha and Mary different in terms of creating a home for these people is that this is more than a job for those people who work here. Those who come here, whether they be employees or volunteers, family, residents, they all come here with a servant's heart, and that transcends everything that they do.
Well, I think the impact that Martha and Mary has on the community is a good one and a great one. They have their child care center, they have their schools, and the nurses and aides here that have children are comfortable. I've talked to them with their children in school, and it's a good service provided to the community.
You know, my experience as a parent and consumer of children's services has been such a positive one. I feel truly blessed to work in an organization that values its employees enough to have quality child care. I have friends who drive 30 to 60 minutes a day just to find the right place for their children. It's one of the biggest worries for a parent. And my husband and I found that right here. And it's not just a quality child care program. It's a place where our children are loved and nurtured. Their lives are enriched every day.
I don't know of any other facilities that have an intergenerational program. And I think for a lot of our residents that are here, that this is their home. A lot of those people don't have any families, or their families are a long ways away. So having the children come down, I think, helps to fill a void in their lives.
The intergenerational programming here, I think, really benefits the community at large. It's bringing our children together with our seniors, and it's not just here at Martha and Mary. Our children in our programming are also visiting community centers, different assisted living facilities, and they're becoming a part of this community. It's really bringing the community together and generations together.
There are opportunities for entry-level workers to get that first really important job in their careers. There are opportunities for technical and professionally advanced citizens to get employment in this kind of an organization. So from a workforce development and retention standpoint, Martha and Mary really provides entry and career sustenance for people to be able to not only begin their work careers here, but to work in this kind of environment really throughout their career lives.
Martha and Mary invest in its employees in many ways. As someone coming in entry-level position could be a laundry aide, housekeeper, dietary aide, and they come on board. They have the opportunity to continually grow into a professional job. They can enter the CNA course that will put them in the initial steps of the healthcare field. And if they continue on, they can progress either as a professional CNA. We have preceptor programs and mentor programs. Those are folks that come on board and they teach the new folks coming on board. And those who achieve and want something more and want to become a licensed nurse, we have LPN programs and RN programs where we have loan forgiveness, where we can provide some financial aid to help defray the cost of their education.
We have a program here at Martha and Mary called the Forgiveness Loan Program, which is it's a win-win. It's great for the employees and it's also great for Martha and Mary. And the way it works is an employee that's been with us in typically an entry-level position for at least a year is welcome to apply to this program. It's a competitive process, and when they're selected, what happens is Martha and Mary ends up funding all or a part of basically their college program, typically for healthcare occupations like RNs, LPNs, or physical therapist assistant. One of the real success stories is Jackie Lincico. She's been a nursing assistant for over 10 years, single mom, mother of 4, and with help from Martha and Mary as well as some other constituents, she's putting herself through LPN school.
My dream is to become a nurse someday. I always love helping people, and now Martha and Mary has beginning to make my dream come true.
I think our community here is better off to have Martha and Mary here. It is a rich tradition here in Paulsbo, and Martha and Mary is committed to the community. You can see over the years as we've changed with the changing times, not just in the time I've been here, but changing from being an orphanage to a retirement home to a skilled nursing facility who did long-term care, now to a skilled nursing facility that does memory care, long-term care, Medicare, short-term stays. I think that Martha and Mary, with its commitment to the community, has met the changing needs of the times.